Hello everyone, I am myself Dr. Rajesh Gubba. I am the general medicine educator. In this session I will be discussing a very important topic in the neurology, that is the viral encephalitis. So you need to know what are the viruses causing the encephalitis. So first of all, what is encephalitis? It is the inflammation of encephalon, that is inflammation of the brain parenchyma. Right, so that is what is called as encephalitis. And you see, the common viruses which will cause encephalitis, it includes the arboviruses, and these arboviruses includes Japanese bee encephalitis virus, right. Second important virus is the enterovirus, followed by that we have Herpes Simplex Virus 1 and then mumps. So these are the common viruses which will cause the encephalitis. And what are the less common viruses which will cause the encephalitis? That includes cytomegalovirus, next the Epstein-Barr virus, HIV, next measles, and we also have varicella zoster virus. So these are the viruses, these are the less common causes for the viral encephalitis. And certain rare causes for viral encephalitis include adenovirus and as well as the influenza. Right, adenovirus and then influenza. And we also have rabies and as well as rubella. So these are the rare causes for the viral encephalitis. So overall these are the organisms which will cause the viral encephalitis. And recently we have the Nipah virus. This particular Nipah virus, it is a new member of parenchyma family. Right, parenchyma virus family. So this particular Nipah virus is also associated with the development of the viral encephalitis. Now among all these, the most common cause of the sporadic viral encephalitis, the answer will be HSV1, and the most common cause of the epidemic viral encephalitis, that will be the arboviruses. Right, that will be arboviruses. And most common cause of viral encephalitis in immunocompromised patients, that includes the cytomegalovirus. And the most common cause of the viral meningitis, that will be enterovirus. Right, that will be enterovirus. And if you take the HSV type 2, HSV type 2, that is herpes simplex virus type 2, it is the one which will cause the aseptic meningitis. However, encephalitis following HSV type 2, it is not been mentioned anywhere. Right, so this will be the common cause of aseptic meningitis, but this will not cause, right, this will not cause the viral encephalitis, whereas HSV1, it will cause the viral encephalitis, and the most common cause of sporadic viral encephalitis is HSV1. Then you take this arboviruses. So arboviruses, that includes Japanese encephalitis. Right, that includes Japanese encephalitis. So Japanese encephalitis virus, it is an arbovirus and it is one of the most common causes of encephalitis outbreaks. Right, the most common causes of encephalitis outbreaks will be the arboviruses. And the most common cause of viral meningoencephalitis, that will be enterovirus. So to summarize the most common causes, most common cause of sporadic viral encephalitis, that is HSV1. Most common cause of epidemic viral encephalitis, that is arbovirus. Most common cause of viral encephalitis in immunocompromised individuals, that is cytomegalovirus. And most common cause of viral meningitis will be enterovirus. And HSV type 2, it is the common cause of aseptic meningitis. And this Japanese encephalitis virus, which is an arbovirus, that is one of the most common causes of encephalitis outbreaks. And the most common cause of viral meningoencephalitis will be enteroviruses. Now, you see this question, which of the following is the most common cause of meningoencephalitis in children? Mumps, arbovirus, herpes simplex virus, and then the enterovirus. So, the most common cause of meningoencephalitis in children will be enterovirus. Next, you see another question. A young male develops fever followed by headache, confusional state, focal seizures, and right hemiparesis. MRI performed showed, the MRI shows bilateral frontotemporal hyperintense lesion. The most likely diagnosis is acute pyogenic meningitis, herpes simplex encephalitis, neurocysticercosis, carcinomatous meningitis. So here the answer is the herpes simplex encephalitis. Now let me discuss in detail about this herpes simplex encephalitis, but before that let me just give you, or let me just, okay, in the end I will show you the workup of this particular patients with the encephalitis. So if you take herpes simplex virus 1, which lobes are commonly affected in HSV1? So frontal lobe is given as number 1, parietal lobe is given as number 2, temporal lobe is given as number 3, and occipital lobe is being given as number 4. So in case of herpes simplex virus 1, the most common lobe which is being affected is the frontal lobe, right? So the focal findings in patients with encephalitis should always raise the possibility of HSV encephalitis. And which part of the frontal lobe it is? The inferior frontal lobe, right, the inferior frontal lobe, and as well as the temporal lobes. Right, inferior frontal lobe and as well as the temporal lobe. So if you take the inferior frontal lobe, that will be the cingulate gyrus. Right, that will be cingulate gyrus. So these are the lobes which are commonly affected in patients with herpes simplex virus encephalitis, right? And in case of encephalitis, if there is focal findings, always it is suggestive of herpes simplex virus encephalitis. Now, so even if you take this lobe involvement, in most cases the involvement is unilateral, right? In most of the cases the involvement is unilateral, but contralateral involvement may also be seen, and patient may present with asymmetrical bilateral temporal lobe involvement. right? In most cases, the involvement is unilateral, but contralateral involvement may also be seen, and patients may present with asymmetrical bilateral temporal lobe involvement. So these are the two lobes which are commonly affected, frontal lobe and as well as the temporal lobes which are commonly affected. Now, if you see the workup in patients with the encephalitis, so very important thing is to differentiate whether the individual is having meningitis or encephalitis. See, the patient is presenting to you with the history of the headache, fever, with or without nuchal rigidity, and the individual is having the altered mental status. If there is altered mental status, yes, it is meningoencephalitis, and if there is no altered mental status, then it becomes meningitis. Then followed by that, if it is like meningoencephalitis, the next important thing that you need to do is you need to obtain the blood culture and start the empirical antimicrobial therapy, right? You need to start empirical antimicrobial therapy. Now, followed by that, you also have to do CT or MRI of the brain. MRI is usually more preferred. And if there is presence of the mass lesion, you need to make out whether it is an abscess or a tumor. And if there is no mass lesion, and if there is focal or generalized gray matter abnormalities, then you need to suspect the encephalitis, right? You need to suspect encephalitis. And if it is encephalitis, immediately you have to do blood culture and as well as the lumbar puncture. And if lumbar puncture, if it is showing the pleocytosis, that is what is suggestive of the encephalitis. And what type of pleocytosis will be there, I will discuss. Whereas on the side of meningitis, if you see, the individual is having papilledema and focal neurological deficit, if it is present, then it becomes the meningoencephalitis itself. So what you want to know, you have to learn from this is, in patients with meningoencephalitis, they will have altered mental status. If at all, if there is no altered mental status, if the individual is having focal neurological deficit, then also you need to consider the meningoencephalitis. So basically, in patients with viral encephalitis, they will have headache, fever, and they can plus or minus nuchal rigidity. And altered sensorium will be there in patients with the meningoencephalitis, and they also can present even with seizures, right? They also can present with even with seizures. Okay, so this is about the clinical features and as well as workup differentiating meningoencephalitis and as well as the meningitis. Now let me discuss the investigations in patients with herpes simplex virus 1 encephalitis. So first important thing is MRI scan. MRI scan features of the HSV encephalitis, if you see, there is presence of hyperintensity on T2 weighted sequences. Right, hyperintensity on T2 weighted sequences, and this particular hyperintensity on T2 weighted sequences, they are present within the medial temporal lobes. Right, they are present within the medial temporal lobes and inferior frontal lobes. Right, medial temporal lobes and inferior frontal lobes. So hyperintensity is seen on T2 weighted sequences, whereas hypointensity it is seen on T1 weighted images, right, seen on T1 weighted images. So that is about the MRI scan of the herpes simplex virus, the encephalitis, right? And so you can see this MRI, the magnetic resonance imaging, the two, a FLAIR image of a patient with the herpes simplex encephalitis. Now, if you take EEG in patients with the viral encephalitis, the EEG, it shows periodic temporal lobes spikes. Right? Periodic temporal lobes spikes. These periodic temporal lobe spikes on a background of slow or low amplitude activity on the EEG, right? Periodic temporal lobe spikes will be there on a background of slow or low amplitude activity on the EEG. So that is about the EEG picture. And CSF examination, if you see in patients with the viral encephalitis, you have to take at least 20 ml of the CSF, right? You have to take at least 20 ml of the CSF. And what does the CSF picture show? That will show you the presence of the pleocytosis. Right, that will show you the presence of CSF pleocytosis, right? And which particular cells are elevated? That is lymphocytic pleocytosis. Right, lymphocytic pleocytosis will be there, and along with that there is mild elevation of protein as well, right? And the glucose will be normal glucose concentration. Right, normal glucose concentration. So that will be the CSF examination in patients with the viral encephalitis. And you need to do CSF PCR in order to pick up the herpes simplex virus 1 organism. Now, followed by that, if you see the treatment in patients with the herpes simplex encephalitis. So, the drug of choice in case of herpes simplex encephalitis is Acyclovir, Zidovudin, Mantidine, Vidarabin. Drug of choice will be Acyclovir in case of the herpes simplex encephalitis. Then, followed by that, apart from the herpes simplex encephalitis in adults, so in adults you will give Acyclovir. And what about in neonates? In neonates also it is the same Acyclovir. Whereas herpes simplex keratitis, you need to give Vidarabin. Or you need to give trifluridine. Then herpes simplex orolabialis, here the drug of choice is penciclovir. Right, you need to give penciclovir. So that will be, right, so that will be the drug of choice in case of herpes simplex orolabialis. And followed by that, you see this clinical based question. A 62-year-old woman, she presents to the emergency department for the evaluation of a seizure. The patient is lethargic and confused. Her husband reports she has an epilepsy that has been complaining, and she has been complaining of headache for past 3 days. He also states that the patient has been somewhat confused. On examination, patient is noted to have a low-grade fever. The remainder of her vitals are stable. Her physical examination is otherwise unrevealing. CT scan revealed hypodense lesion in the right medial temporal lobe. Lumbar puncture is performed, revealing elevated opening pressure, mononuclear pleocytosis, moderate RBCs. Which of the following viruses is most likely responsible for this patient's clinical picture? Varicella zoster virus, Herpes Simplex Virus 1, cytomegalovirus, Herpes Simplex Virus 2. So here the individual is having the focal manifestations. That is, the CT scan is showing abnormality within the temporal lobe, and along with that the individual is having fever, headache, confused, and the individual is also having seizures. Seizures, it need not be there in all the individuals, it can be there up to 40% of patients. And for suppose if this temporal lobe which is affected is left-sided temporal lobe. Left-sided temporal lobe is nothing but your dominant temporal lobe. If there is left-sided temporal lobe involvement is there, the individual can have aphasia, right? The individual can have aphasia, okay? And the CSF is usually abnormal in case of herpes simplex viral encephalitis. What will be there? There will be mononuclear pleocytosis, opening pressure will be there increased, and even there will be mild elevation of the proteins. So what is that particular virus now? That is HSV1. HSV1 will have the focal involvement of the medial temporal lobe, and as well as there is also involvement of the frontal lobe. And EEG, what did I tell you? You will have that particular temporal spikes. That completes the discussion of the viral encephalitis, out of which the HSV1 encephalitis you need to be very much aware of. The drug of choice will be Acyclovir. So this completes the discussion of this topic of viral encephalitis. Thank you very much.